So for this task, we're going to discuss keeping operative records. So it's important to make sure that we have all of the records that we will need in order for our patients on a daily basis, whether they're having an anesthetic procedure or not, but this is in the case of them having an anesthetic procedure. So we always make sure that we have a basic check-in sheet paper here. Now we are a paperless clinic, but we do usually print off a check-in sheet just to make sure that we can write most of the information that we have off. We also like to make sure that we have the consent for treatment, and it was signed by the owner. And then on here we basically discussed that we went over the estimate with the owner, and we gave the owner a copy of the estimate as well. And here we also have our patient's most recent physical exam, which was this morning before the anesthetic procedure. And then we also record our last blood work or a preoperative blood work test that we had done as well, just so we can overlook everything and make sure that our patient is okay to go under anesthesia. So for our check-in sheet, we basically record the weight of the patient when they came in this morning, and the temperature of the patient as well. And also before we give them any kind of induction agent or pre-medication, we do listen to the heart, get a heart rate and respiratory rate as well. And then we continue to monitor those parameters as they have their pre-medication and as they are induced, and then during the whole point of anesthesia and while they are recovering as well. And usually we'll do it before they go home as well with the owner, just to make sure everything is okay. So on our check-in sheet, we have what the patient is coming in for, we have the date, we have the owner's name, the owner's client ID number, their phone number, their address, email, patient ID, basically the patient's name, the breed, the color, age, and whether they're spayed or female spayed, male neutered. We have the name of the doctor on here as well, and then we do have the weight and the temperature recorded for the day on here. And then, like I said, on the next page, we do have our consent for treatment, and we have recorded on here too the owner's phone number, best for us to reach him at during today, and then the last time that she has eaten, and then any kind of medications that she may be on. And then we also have basically, if the owner agrees to CPR or no CPR, do not resuscitate as well. And we have his signature and his date on here as well. And then, so we do just, kind of look over the physical exam, make sure everything looks okay, and the blood work, and make sure that all is normal and looks okay before we go ahead with our anesthetic procedure. And then, so we have our monitoring form here. And so this is basically what we'll use while the patient is under anesthesia to monitor all their vitals. And so on our monitoring form, we have our patient's name, our client's name, their age and date of birth, the weight, and then the weight in kilograms as well. And then basically the classification, the ASA classification for our patient, the procedure being done, the doctor, the anesthesia technician that is assisting or circulating nurse technician who's taking all the vitals. And we do have medical alert information for any kind of alerts that you might need to be aware of, such as the patient was diabetic or if they have a reaction to isoflurane previously before. So then on here as well, we do have our pre-medication, induction, and maintenance. So basically for pre-medication, we'll put butorphanol, 10 milligrams. We'll do the dose, the milligrams, the milliliters total drawn up, given, and the route given and the time that it was given. And then I do have a little note here that I did log that already since it was done earlier today. And it's very important to make sure that I do log my drugs, and I log them with the correct amount that was actually given rather than drawing up the drug and writing the automatic amount of the drug on this form. We want to, then we write the drug that was drawn up out of the controlled substance for what we draw out of the bottle, but as far as what we give, we don't put it on the anesthetic form until we give our patient, such as propofol. Usually you give it to effect, you give a little bit and then you give to effect, so we don't always use all the propofol, so it's important that we record the amount of propofol that we actually used instead of the amount that we drew up. So that is on here as well. Got my propofol, my milligram per milliliter, my dose, my milligrams, and then maintenance, usually isoflurane and oxygen. We do have what kind of system we use, rebreathing or non-rebreathing, and then we have the endotracheal tube size. And then here's where we start to monitor our vitals. Down at the bottom I do have where we intubation time, extubation time, surgery start, surgery stop, and anesthesia start and anesthesia stop. Basically, we just like to record the times of when, from basically the first cut that the doctor makes to when they're finally finished with surgery, to all the way to the extubation point in time, and of course when they're actually on anesthesia versus not on anesthesia. So as far as vitals go, we monitor our patient, like I said, before they are given their pre-medication. We monitor our patient after they've gotten their pre-medication, during induction, and then of course during the whole time of surgery, and then recovery as well. So we start to monitor on this record basically when they are induced. So we do have time on here. We monitor about every 5 minutes, and we monitor heart rate, mucous membrane, capillary refill time, blood pressure, respiratory rate, and tidal carbon dioxide, SpO2. We monitor the amount of fluids that they have been given during this every 5 minutes. We monitor what kind of thermal support that we have. So usually we'll have a circulating warm water blanket for them, bear hugger, or some kind of warm towel on them as well. So we do also monitor the temperature, and then we also have on here where we put our ISO percentage, isoflurane percentage, and then our oxygen rate as well. So again, we monitor those parameters about every 5 minutes. And then down here I have where our IV fluid rate is at. So let me put this back on here, slim. And then, so we have our IV fluid right there, and usually write milliliters per hour, and then what kind of solution it is. And then we do have recovery here as well. So basically after we extubate them, then we put them into recovery, and then we start to monitor them again about every 10 minutes. So for when we're monitoring them, we usually monitor the temperature, the heart rate, the respiratory rate, and their mucous membrane color, just to make sure everything is staying nice and normal looking during that procedure. Also on our anesthetic form, we have a spot here for emergency drugs. So if we had any emergency drugs that were given, we will write that on our form. We do have several charts in the hospital that are readily available for us that go by weight and drug in case an emergency were to happen. So we do keep those nearby while we are in surgery. And we do just confirm the patient's weight as well before we end up drawing those drugs up and giving them. But if we were to give anything, we could put the dose, the milligrams, the route, and the time that it was given. And then we also have a place right here for amount of staples, sutures, and basically any other supplies that we might use while we're in surgery, such as other packs of suture or packs of gauze, stuff like that, anything that we might need to replace. And then we do have a spot here for additional comments, and usually we'll write on there, such as if a dental procedure, we'll write no extractions, or if it was some kind of growth removal, we'll write sent to lab. And that's pretty much it for our anesthesia log. And so I'll go over our controlled substance log here now. So we do about a monthly inventory of our controlled substances, just to make sure that everything seems to be on hand, everything is in order. It's really important that we do this and keep this in order. We don't want to get in trouble with the DEA. So all the controlled substance that we used today for our patient was butorphanol. So I just went ahead and flipped our butorphanol page. And so I have, on this page, I have controlled substance received drugs log. So basically I just kind of write on here as we receive a bottle, I write the name of the bottle, each bottle has a number, I'll write the lot number, the date that it was opened, and the date that it was inactive. So this paper here shows our usage log here. And so we actually opened a new bottle today for our butorphanol, 10 milligrams per milliliter, what is a class 4, schedule 4 drug. And I do have our lot number, expiration date, the number of the bottle, which I always confirm and I make sure before I pull the drug up or before the doctor pulls the drug up that that is the correct bottle that we have. We never want to give a expired drug that might have just recently expired in there and it hasn't been taken out yet. So we always do double check that, confirm, make sure that is good. For our usage log here, we do have date, patient ID number, the patient name, the client's name, the species, the weight, who the drug was drawn up by, the total milliliters that were drawn, and then we do have a section here for waste. We usually count for a hub of waste for each syringe that we'll draw something up with. So like I said, I've already done this for today because it was done earlier today, and I'm really careful about making sure that I record the controlled substances very often. So I've put my date, I've put my patient's ID number, her name, the last name of the client, the species, that she was a dog, she weighed 65 pounds. The medication actually was drawn up by the doctor, and so her initials are there. And so total drawn is 0.58 mLs. And then usually we'll count for 0.04 mLs for waste, for hub waste, basically hub loss into the syringe. And then so the total amount that we had in the bottle is to start off with was 20 milliliters. So we subtract everything, so it becomes 19.38 milliliters in the bottle. And then I just recorded my initials here on the side just to know that I am the one that entered it into the drug log. And so again, once that is completed, and only after I complete that, then I will mark on my anesthetic drug form here that I did log the drug. And usually what we'll do with this paper as well, since again we are kind of paperless, is we'll take everything after the surgery and we'll enter it into the patient's record on the computer, making sure that, again, that double check everything that matches, making sure our drug log matches in our computer inventory as well. And then for all the paper that we do use for the day, we do end up recycling the paper. So we do kind of stay paperless for the most part. And that is it.